our fourth-year students the opportunity to apply all the learnings that they have, especially on leadership and management. Today's theme is Nurses Convergence on Lifelong Learning and Quality, a webinar on evidence-based practice in the nursing profession. Education does not end after nursing and become a licensed RNs. Instead, we start on a path of lifelong learning that goes on throughout our nursing career. It's critical that we continue gathering information to keep abreast to changes in nursing. Lifelong learning gives nurses the critical thinking and problem-solving skills needed to resolve issues that we may encounter while taking care of our patients. When nurses are up to date on new techniques, and procedures, they will have a great influence on healthcare. So, gentlemen, I assure you that this seminar will be profitable and fruitful for everyone. Thank you.
Thank you, ma'am, for your wonderful welcome remarks to our listeners, speakers, and guests. We appreciate your time and effort for joining us today despite your hectic schedule.
All right. Let's make this quick, and I'm pleased and excited to proceed with the highlight of this webinar entitled Nurse Convergence of Lifelong Learning and Quality Improvement. A webinar on evidence-based practice with a theme of evidence-based practice in the nursing profession.
I agree, and it also excites me when I've heard that our guest speaker is handsome, talented, and down-to-earth person.
He is also a quality improvement mentor in Asian Hospital and Medical Center, which focus on providing safety, reliable care in the healthcare organization.
He is also an aspiring mixed method researcher from the program Doctor in Nursing Management in Trinity University of Asia, who is particular with intricacies of methodology, interpretation and analysis, and application of study.
His passion was to serve the community and started from Miss Ceres,
Bachelor of Science in Nursing of Lyceum of Philippines University, Batangas,
which made him the prime mover in the promotion of mental health, developing youth leaders, and sustaining health well-being of the society.
He has been a 14 years volunteer instructor of the Philippine Red Cross Youth and Safety Service.
He is also a poet,
an educator,
and a leader.
Let's give a virtual claps to welcome our speaker,
Dr. Mignadel M. Morales.
Thank you very much. Is my audio clear?
Yes po, Doc.
Ika nga sa Batangas, magandang hapon. Okay, so yan sa Norte. Okay, so good afternoon, students and guests. Thumbs up, thumbs up, thumbs up. Evidence-based practice in nursing profession towards a better outcomes. Fellow students or nurses, I want to say. I want to solve a problem. What can we do with this problem? Type your answer. How will you solve a specific problem? 10, 9, 7, 3. Okay? Unresponsive. Code blue, code blue. Okay, unresponsive. Analyze, research, think, analyze, research, and copy paste. Know the problem first, of course. Decide, pray. Oh, that's very powerful. Don't panic. Chill. Plan. So, we do our ADPI. You assess. You diagnose. You plan. You intervene. And you evaluate. Would you agree? Thumbs up if you agree with that. Now, we'll focus on I, interventions. Please give me some heart or thumbs up. Is nursing profession an independent body of knowledge? Is nursing profession an independent body of knowledge? Very good. Non-responsive, unresponsive, code blue again. There's no response. We are an independent body of knowledge. Right? So let's proceed to my learning objectives. First, we will identify the different steps of evidence-based practice. Second, to determine the importance of evidence-based practice in the context of healthcare. And last, to appreciate evidence-based practice in the clinical healthcare setting. Is banana leaf can prevent pressure ulcer? Is every 2 hours of turning and positioning the best method of preventing pressure ulcer? Let's answer that question later. Heart, heart, heart. Okay, so let's proceed. Based on the World Economic Forum, these are some of the challenges of health of 2020. Number 1, elevating health in the climate debate. Second is delivering health in conflict and crisis. Until today, we are at war. Pero hindi natin nakikita. We are at war versus our COVID-19. Next, making healthcare fairer. Is vaccination are equally distributed today? Next is expanding access to medicines. Some of vaccines of today is not only intramuscularly, but they are taken it orally. Some of our scientists, Filipino scientists are doing experiment that COVID vaccine will be given in the route of per oral. Exciting. Next is stopping infectious diseases. Take note. And next is preparing for epidemics. Singapore wants to level down. They want to have epidemic as they coined the COVID-19 on their case, on their country. Next is protecting people from dangerous products, investing in people who defend our health. Like today, who's the soldiers in the hospital? Nurses. Would you agree with me? Nurses are the soldiers in this time of war. Keeping adolescents safe. And last, earning public trust. A big word. Pagtitiwala. Fellow nurses, may I ask you, in a personal note, what's your criteria in trusting a person? Type your answer. What's your criteria in trusting a person? Pinagkatiwalaan ko to. What's your criteria of trusting a person? Credibility, reliability, loyalty, background. What else? Consistency. Their good deeds, knowledge, and compassion. Honesty. Character. What else? Sincerity and care. The words are four. Evidence-based nursing practice. Evidence-based nursing practice. Evidences. No? For us to be independent of our practice, we should have that a lot of evidences to support our independent interventions. Evidence-based nursing. Nursing is a separate profession that our core is caring. And last is practice. We implement what we do. So, in EBP, or evidence-based practice, we utilize our research outputs. We utilize the conclusion of your thesis. We utilize the recommendations of the dissertation and the thesis of master's and doctorate degree. So, what's happening? I want to give you some thinking for this day. Is nursing a separate profession from the medicine profession? Or we copied most of the practices of doctors and translated into nursing practice? What do you think? Are there evidences that if we touch our patient, we heal the patient? If we have therapeutic communication, do mortality and morbidity rate decreases? Is nursing care plan gives good outcomes? So now I want to challenge our idea. Is nursing profession an independent profession? Okay, so let's proceed. According to Margaret McCarthy, ignoring evidences leads to avoidable harm, and failing to admit our uncertainties means don't get better evidence. There's changes if we place a banana leaf on a geriatric patient and we change that banana leaf every 2 hours or every shift. Thus, it creates moisture that sustains the moisture of the skin. Thus, there's no skin breakdown. So, if we ignore that evidence and thus they create avoidable harm, because pressure ulcer should be avoidable. If the patient is admitted in our hospital, we should not get any harm or inflicted harm to our patient, such as IV complication, fall incident, and even pressure ulcer. So if you did not check or even analyze our data, the patient will be hurt. Okay. Next. Thank you. So evidence-based practice entails problem solving. I totally agree with you. There should be identification of problem. For us, in the healthcare setting, what are the most common medical errors? Please type your answer. What are the most common errors in the hospital? Drug medication, medication errors forever. medication errors. So, yes, that's only the first step. You identify the problem. And now, how we solve it? How can we solve a perpetual problem? Sir, ang tagal na nung, yung problemang yung medication error. No? 10 years na ako sa nursing. Medication error pa rin. Do your problem-solving steps. After identifying the problem, do some literature review. What are the best practices across the healthcare organization that is feasible to your organization? Are there a problem of computation? Are there a problem of endorsement? Are there a problem of dispensing? So in your problem identification, you should be specific. Specific. Is that dispensing error? Is that administering error? For us to have a specific solution to your problem. Sir, and if evidence-based practice is grounded to research. Yes, we should love research. Heart, if you love research. Yeah. Labas sa ilong, I love research. I'm also a professor in nursing research 1 and 2. Okay, so research-based. Why? Because in research, we get a lot of evidences and we challenge the status quo. We challenge the theories. We challenge the conceptual model, the theoretical model for us to prove what's the most effective way of doing it. Computation? Maybe we should remove the human factor. Can we have a specific dispensing medication that if I need 1 milligram of epinephrine, they will give me a specific ampule? Or in collaboration with other healthcare providers, such as our clinical pharmacists, they will give us and dispense us in an aspirated syringe. Will you agree with me? Is that feasible? Is that feasible? Yes. Do you think there will be decrease of medication error? Yes. What else? There's a lot of time consumption regarding signing of medication administration record. Why not automate it? You click on the iPad and 10 minutes will be deducted on doing signature or clerical works of nurses. Thus, the 10 minutes will be allocated to nursing care. Thus, it creates a more outcome-driven. Patient satisfaction is increasing, and even me as a nurse, I'm satisfied on my job because I embrace what I'm doing. I'm a nurse. I'm not a secretary. I'm not a clerk in the hospital. I'm a nurse. Nursing should do a nursing job. Remove the non-clinical. Will you agree with me? Sir, outcome driven? What's outcome driven? Patient harm, medication error, adverse drug reaction. These are the outcomes of your medication error. What else? Cost. Diba? Gastos. Naturukan mo times 10. The reversal agent of that will be what? Who will pay for that? The reversal agent? The nurse? The patient? Or the hospital? Would you agree with me? That's the outcome. The dissatisfaction of patient. Naku, nagkamali daw yung nurse ko kanina. Naka times 10 daw ang naturok. The best advertisement will be the patient itself. Masisira at masisirang ospital. Nagkakaintindihan ba? Would you agree with me? Kaya very, very careful. No? One mistake can ruin a hospital, or a best practice of a single nurse could uplift the hospital. Okay? Again, it's a problem solving, it's a research based, and last, it is outcome driven. These three definition of evidence based should be in your head always. Why? Because in the future, as nurses, all of our actions should be backed up with evidences. Okay? Bakit tayo nagba-vital signs every 4 hours? Di nyo ba na-ask sa sarili nyo? Why we are doing vital signs every 15 minutes? If we are infusing blood. Challenge that idea. And we will create our own evidences, evidence-based nursing practice. And we are proud that this is a nursing practice, not a medical practice, not a pharmacist practice, but a nursing practice. No? Is therapeutic massage could increase likelihood of discharge, no? Or decrease the length of stay. May research na ba no? Wala pa. Is herbal medicines, no? Could eventually used, okay, to prevent our patient in accessing emergency care. Diba? So we should use that knowledge. However, nakakalungkot, we don't have any evidences. No. Sir, we have a lot of research regarding medicinal plants. But did we use the results? Did we apply the recommendations? And did your research create policy development and even having a law to support your research? Di ba wala? Ang galing nating gumawa ng mga research, but where's the result? Okay, next. Okay, these are the components of evidence-based practice. Number 1 is the clinical experience. Nurses, in the future, you will have your own track. Nursing educator, nursing pediatrician, okay, pediatric nurse, maternal and child nurse, OR nurses, ER nurses. So based on your specific areas of specialty, you can come up with your own practices, and you can challenge your practices and do some research. Sir, kayo, what's your specialty? My specialty is maternal and child, ICU, and psychiatric nursing. So I'm a psych nurse. So I want to challenge the therapeutic communication. I want to challenge some of our practices here in the Philippines that, di ba, nakakahiyang mag-divulge, no? If you have mental illness. Tama ba? Would you agree with me? You're very shy to consult a shrink or even a psychiatrist or even a psychologist. Thus, that culture of Filipino culture affects the outcome. Hindi natin nakakapture, nagpapakamatay na siya, and eventually, mortality talaga. Fatal ang pagkamatay. So now, I want to challenge that. Do we have, or do we understand the culture of Filipino? Bakit ayaw nilang i-divulge? Diba? Not in the Western country. Diba? Sasabihin nila na, magpapakamatay ako bukas. Diba? Ganun sila ka-open at ka-liberal. So, wala pang nag-create ng research nun. Why there are practices in the Filipino culture that's very pertinent to us, that affects the outcome of healthcare outcome. So, kami, as a psychiatric nurses, we can delve on this because it's a mental health issue. Okay? Clear? Clear po ba? So, in the video of J&J, as you can see, they do the, what do you call this? The phototherapy for jaundice. Tama? So, that's a clinical experience of the pediatric nurses. And they saw there's an improvement. So they use it. So that's the evidence-based practices. Next is we have best scientific evidence. Again, best scientific. Scientific is empirical, and it gone through a scientific process. So it means that it undergo research, rigorous research. So for us to use an EVP, it should undergo a lot of research, and you have a lot of references to back it up. And last, and the most importantly, is the patient values. There should be an acceptance of our patients. Sir, let's place the banana leaf at the back of the patient. But the patient refuses. Even though there's best clinical evidence and it's based on the clinical experiences of the ICU nurses, but it's not the patient's preference. So it will not be utilized. Okay? Clear? Clear po ba? Okay. So again, these are the components of evidence-based practice. Clinical experience, best scientific evidence, and patient values. Next slide. Steps in evidence-based practice. Number 1, identify a specific problem. Ano bang problema? What's the problem? What's the problem? Today, we have a lot of COVID-19 patients. Would you agree with me? Here in Manila, we don't have any vacant ER rooms, even ICU rooms. That's a problem in healthcare. Some of the patients died outside the ER or even at their home. It's a problem. Gather evidences. Pre-pandemic, we have a lot of evidences that telemedicine is effective in creating a safer healthcare to our patient. Even in a teleconsultation, and they have the means to buy some of the basic, such as the oxygen, the vital signs monitoring tools or equipment. So gather these evidences that through telemedicine, it can have a positive prognosis, and analyze this evidence. Later, gathering, analyze will be discussed in the PICOT, okay? PICOT framework, okay? How will you appraise the different references? And next is we implement. Like experimental research, we should implement it and try to evaluate if it's effective. The evaluation part will be based on the outcomes. Okay? Is the patient satisfied? Is the patient survived? Or the mortality rate, no? And the acceptance rate, okay, of telemedicine. So that is the basic process of evidence-based practice. Problem identification, gather evidence, analyze evidence, implement, and evaluate. It's the same as doing your letter R. Type your answer. Very good. The same as your research. Love your research, no? Okay, so let's proceed. So these are, this is one of the framework to be utilized, that can be utilized in appraising your references. First is the PICOT framework. PICOT means patient and population. So if you get a journal, no, in a reputable journal, no, get the literature in a reputable journal, Scopus Index, Science Direct, no. So check first the patient and the population. So it's a tabulation. Later, I can show you some samples. We have patient and population. So is it from Eastern or Western countries? Is it Asian countries? No. Then we have the intervention. In this research, what are the specific interventions they used as a variable? In my example, will be telemedicine. And comparison, it means that telemedicine and there's no telemedicine. Okay? So telemedicine and no telemedicine. And the outcome will be the patient survived or the patient died, or the patient is satisfied or the patient is dissatisfied. And last is time. Time entails the duration of your research. Is it within 6 months, or is it longitudinal study, years of study, so or cross-sectional study? So through this PICOT framework, you analyze um, different evidences. No? You check, you analyze, you compare, and you conclude. After conclusion, you will create an action. What will be your implementing practices in your hospital? And it doesn't mean that you have a lot of evidences. Your outcome will be the same. Okay? Please be careful with this. Oh, it's effective in Mayo Clinic. It's effective in Johns Hopkins Hospital. Stop. Because there's a lot of external factors that will contribute in the implementation of a specific intervention. Would you agree with me? Would you agree with me? Merely the supply of computers, if it's telemedicine, the bandwidth or the internet speed in the Philippines. So it affects your outcome. Would you agree with me? If it's telemedicine we are talking about. Thus, your outcome will be different to the outcome of the other countries. Okay, be careful on doing your appraisal. Okay? Clear. Heart. Let's go to the personal note. Wait, sorry, go back. Let's go to a personal note. No, it's like you're courting someone. Okay, A, B, C, D. No, what's the patient? Who's this girl? Okay, a girl 1, girl 2. So, and we have a lot of factors that should be considered. No, to patient A or girl 1, we should have this. No, you compare what's the benefits or what are the risks involved in each, or girl 1 or girl 2. So eventually you should decide. However, you have a lot of factors beyond your control. Okay? Maybe hindi mo siya kilala thoroughly. Okay? Maybe you will decide, and if you have a deeper understanding of her, no? Mali pala yung akala natin. Okay? So, ganito yung PICOT framework. Sir, Why we are using this? Because for us to have a standardized approach of dealing with your references or journals. Okay? Clear? Thumbs up or heart? Let's go to the specific sample. Next slide. So these are the components of clinical question. Number one, on your left is the patient and the population. So based on this example, the patient with acute myocardial infarction. So we have women with suspected coronary disease and postmenopausal women. So the intervention will be the doses of early treatment of statins. So these are the anti-cholesterol. What is the accuracy of exercise? And thus hormone replacement therapy. So that are the intervention to prevent, okay, or to mitigate worsening of the clinical case. Then comparison, compared to placebo, compared to exercise with ECG, and compared to no HRT. So based on this, no, we can analyze what are the most, or what's the most effective way, no? And the outcome is there's decreased cardiovascular mortality, diagnosing significant coronary artery disease, and increase the risk of breast cancer. So as you can see, this is more on experimental research. No, may pre and post test, and you want to test a specific intervention if it is effective or not. So this is the simple PICOT framework that you can utilize to assess and to check if it is worthy to use as EVP. Okay, evidence-based practices. Okay, so let's proceed to a specific example. Okay, stop. So the problem is cardiac arrest. No, then gather an evidences, early treatment or early assessment, and you analyze the data. If there's no interruption, there will be an increased chance of survival. So implementation, there's automated compression, because in times of pandemic and disaster, if the patient is outside the hospital, the 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 very critical time is the transportation of the patient. Tama ba? If the patient will be transported to the hospital. But the premise in CPR, you should stop, tama, the vehicle while you're doing the CPR. Thus, some of the literature said that there should be no interruption. So they created an automated compressor. Okay? Then, evaluate good prognosis. No? Mamaya, I will discuss this further in Lucas. No? Lucas is the automated chest compressor. Okay? Question at this moment? Okay? Smile, heart, heart. Next slide. So based on the World Health Organization, the world's leading cause of death is heart. Oy, ang sakit-sakit. Ischemic heart disease, then followed by stroke. Next is we have COPD, lower tract, respiratory tract infection, the neonatal condition, and so forth. So I want to highlight this one, no? Ischemic heart disease. Take note, 2000, in the year 2000, it's 6.8. And it increases from 3 points from 8 until we reach 8.9. So that's a problem. Would you agree with me? It's a problem in healthcare that many of our patients died due to heart disease. So next slide. So after identification of the problem, this is the chain of survival based on the AHA, or the American Heart Association. We have recognition of the problem. We immediately do high quality CPR. Then Luckily, if you are lucky, if there's a defibrillator, you can defibrillate the patient. Sir, in the Philippines, we don't have any defibrillator. Okay. So do immediately high quality CPR. Okay. Then we have basic and advanced emergency medical services, then advanced life support, post-arrest care. So your post-arrest care is in the hospital setting. But the rest of the four chain of survival is pre-hospital. Ibig sabihin, nasa community po yan. So, anong ibig kong sabihin dito? Sir, if the patient, if the world's mortality or the most common death is caused by heart disease, so we should focus on heart disease and how we can improve the practices. So, the most common intervention will be the high quality CPR. And that's the question. And that's our problem. I want to ask you, are Filipino people or in your barangay, sige, in your barangay, all of your barangay members are trained to do CPR? Is all your barangay members are trained to do CPR? Yes or no? No.
No, sir.
So, ibig sabihin, if there's a probable patient having a ischemic heart disease or heart attack, and you are in a barangay 3 hours from the hospital, maybe the patient will die. Tama? The patient will die on transport. Tama po ba? Would you agree? Okay. So the question is, how can we address the problem? Let's do training, sir. One of the criteria of stopping a CPR is what? The rescuer is review on your MS. Tama ba? MS2? Sir, nakalimutan ko na. Kakatapos lang. At risk, what else? Thank you, Miss Sunshine. Very good. Miss Sunshine, exhausted. Hindi nyo nga magawa yung 5 cycles eh. Sir, pagod na po ako sa 5 cycles. Diba? 3 hours po kayo nagsi-CPR. Kaya mo pa ba? Diba? Sir, sabi po dun sa sa AHA, pag pagod na, tigil na. Oh, sakit-sakit naman. Pag pagod na, itigil na. Okay? So, tumigil ka. But, the patient will die. Okay? So, some of the literature stated that there should be no interruption. So, anong ginawa? Click. Next slide. Ito. Si Lucas. Lucas is a device that will be placed on the chest of the patient while the patient is on transport. Ibig sabihin, walang interruption ang kanyang compression. Tapos, ang kanyang compression is talagang accurate. No? 2 to 2.5. Tama? Ang depth. Inches and depth. Okay? But however, basahin natin, despite these theoretical advantages, a study completed in 2014 did not show mortality benefit of mechanical CPR over manual. Ano ibig sabihin nito? Ma-CPR mo siya, ma-CPR ni Lucas, same ang outcome. Okay? But, advantage of reducing rescuer fatigue and diminishing risk to rescuers during transport while CPR is in progress. Okay? It's not only the outcome It's not only the patient's outcome you should focus. It's also the what? The outcome and to the rescuers. Diba? Would you agree with me? No? Hindi pala nasayang yung research kay Lucas. No? Nakita din nila na nag-improve naman, okay? At advantageous ito sa mga rescuers. Okay? Clear? Okay. Let's proceed to sample number 2. New score. Sino ba dito? Nurse Mac? Nurse Mac? Can you take the vital signs of patient A? Hosts, can you take the vital signs of patients B and C?
Yes.
When can you refer it to me as your consultant?
I can refer it to you immediately after doing the
Give me some specific nurse map. What are the
repeat po ulit, sir.
What are the vital signs that should be referred to your nurses or to your consultant?
Unstable vital signs po, sir.
Unstable. Give me numbers.
Above 180 over 100, 110, sir.
Okay, what else?
And high blood pressure, sir.
Okay, high blood pressure. Okay, thank you. The hosts, what are the vital signs should you refer to me as your consultant? Vital signs. It's the fundamentals of nursing. Give me some abnormal vital signs, please. Okay, abnormal vital signs. Give me abnormal vital signs, guys. Thank you. Okay. Nasya kayo. Okay. RR of 40. Very good. Thank you. BP of 140/90. What else? Temperature of? Give me temperature of 38 or 40. Okay. Thank you. Thank you very much. Sir, what's the news? National Early Warning Score. It is coined by the hospital in England that they use a tool for them to address what will be your action as nurses, what will be our action as healthcare providers. You want to know what's the new score? This is utilized by the JC Hospital and hospital in Manila. Okay, so let's check what's the rationale of new score. Next slide. Mismanagement of deterioration. Mac, Nurse Mac, huwag na nating i-report kay Doc. Normal naman yan. 140, okay lang yan. Yan. 38.5, normal lang yan. Okay. Normal. Bigyan mo ng paracetamol ha. Bigyan mo Q4. Ikaw ang umorder. Ikaw na nag-order. Huwag na natin istorbohin si resident. Let it be. Okay? But here, based on the NHS, the mismanagement of deterioration is the most common area of systematic failure. So, ibig sabihin, yung non-referral can cause a bigger problem. No? Nagdi-deteriorate na pala si patient, hindi mo ni-refer or hindi natin inakyat yung ating mga interventions. And 90%, take note of this, 90% of cardiac arrest are preceded by a deterioration of vital signs. Huh? 120 lang kanina yun, over 80. Nag-90-50. Okay lang yun, normal pa naman yun, di ba? Mac, tama? Normal pa naman yung 90-50. Taas ko na lang.
Mababa na.
Mababa siya. Tuloy, taas ko na lang yung paa. Magiging 90-60 yan. But here, take note, nag-deteriorate at it can cause cardiac arrest. Okay? Surveys suggest that about 1/3 of potentially preventable deaths in UK relate to poor clinical monitoring. Take note, clinical monitoring. Clinical monitoring is vital signs. No? Here in the Philippines, more on manual pa po tayo, we're doing it manually. In UK, all of this is automated. No? Kaya nakikita agad nila. Other preventable deaths can often be attributed to an inadequate response. Take note of this, inadequate response to clinical deterioration in terms of urgency of response and the clinical experience and competency of the responders. The patient is the most appropriate setting or ongoing clinical care. Because of your misassessment of the patient, what? It's a domino effect. Our intervention, okay, did not correlate to your assessment. Then the patient will deteriorate. Sakit naman, sir. Kasalanan ko? Hindi mo kasalanan, kasalanan natin. Okay, kasalanan natin. Kasi hindi mo siya ni-refer. Okay? There's Mac. Di ba for discharge yung pasyente kanina?
Yes po, Doc.
Oh, bakit nag-arrest? Di ba? There's a lot of these narrations that bigla nag-cardiac arrest. However, may miss pala tayo. We did not check them correctly. Okay? So, NHS in the UK have this one. Next slide. So, the rationale of this is to have a fast and efficient clinical response and can improve the outcome of the patient. The evidences suggest that the triad, the early detection, that's vital signs, timeliness of response, no? I-CPR ba natin? Hindi natin CPR, dadalhin siya sa ICU, and competency of the nurses, no? And the clinical response is critical to determining the patient outcome. Yung sinabi kanina na 90-50 ang BP, dapat na-refer nyo agad sa akin because I will do something with that. And ang magbibigay lang kasi ng order is the doctor. That is the competency of the clinical response. Okay? The timeliness of response. No? May trend na 120/80, nag-90/50, naging 50/0. You see the trend. If it's early detected, no, the patient will have a higher chance of survival. However, we cannot do it alone because us as nurses, in the premise of the Philippine law, we cannot prescribe. Tama? We cannot order medication. Thus, we should what? Refer them to a competent healthcare providers. Okay? So this is the new score. Chanan! Welcome to the new score. Kita nyo? Ang ganda ng vital signs. Okay? They have a specific scores. No? The normal will be 0, yung white. Then, deterioration, makikita nyo, we have yellow, orange, and red. No? So, there's a scores. No? 0, 2, and 3. So, if you're taking the vital signs, sige, please click po para makita nyo yung form. Please click. Next slide. Next slide. I want to show you the form of vital signs. Hindi siya yung parang blank. Next slide. This is the vital sign sheet. What? Ang ganda! Every shift, every 8, 10, 12, you do your vital signs. Tama? At pag tumama doon sa kulay, you will report na. Did you get my point? Thus, we address the problem. Ang ganda. Kasi, hindi ka na mag-iisip. So, ang vital signs ito, 140, yung katulad 180, red na agad siya. Ibig sabihin, kailangan i-call na agad ang physician. Okay? Sir, marami pong yellow. But total, balik ka Mr. Mac, balik ka dun sa sa may scoring. Balik ka dito, this one. Di ba? Every vital signs, you will aggregate your score. 0 to 4, word-based response. It means it's a normal response. Vital signs taking, feeding, and such. No? Then if it's low to medium, we have 3. Okay? 3 on score. We'll have urgent ward response. No? You can refer it to your senior nurse, okay, or your physician. Next is, if it's medium, key thresholds for urgent response. You can call a code, maybe a purple, a rapid response team to address the decreasing BP. And last is high, urgent or emergency response, that the patient will be transferred to ICU. Did you get my point? Ang ganda. There's a system and it saves lives. Okay? Let's proceed. Next slide. Yellow is 1, orange is 2, and 3 is red. So if you tally it, every shift or every vital signs you take, you can ask or refer the patient based on this criteria. Okay? So, second sample. And for our last sample is mindfulness. Fellow nurses, please open your camera. Smile. Inhale. Exhale. Ang baho. Mag-toothbrush. Okay? Evidence-based practice is 3 times a day. Okay? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Natutulog na kayo. Okay, matulog. Okay? We have a session here. Okay? So this is the last 3 slides maybe. So next is the mindfulness. No? Mindfulness-based stress reduction for psychological distress among nurses, a systematic review. So mindfulness, no? Deep breathing exercises, aromatherapy, and even yoga, no? As an exercise or even meditation. So these decreases the psychological distress among nurses. In these times of pandemic, nakaka-stress na, di ba? Online learning pa lang, stress na, di ba? So I've given you the glimpse of mindfulness. No? Your focus on your breathing pattern, no? The inhalation and exhalation process. So to that, it increases, no, based on the studies, found that eligible and included in this review many benefits, including reduced stress, anxiety, depression, burnout, better job satisfaction were reported in these studies. So, this result should be translated into practice. That's EBP. Nakakalungkot. We have a lot of scholars, nursing scholars in the Philippines. And their dissertation and theses are being what? Are being published only in our libraries. and it's not utilized. So please, fellow nurses, no, nursing leaders, okay, young leaders, please make sure that if you conduct a research, you should not only the end of research is not only in the publication, it is how you utilize it, how it create an impact to the society. Sir, the research is very good. Yes, yes. And there's a lot of evidences. Yes. But why there's no training about mindfulness? Why is there's no training and even lectures about yoga in hospitals? Did you get my point, po? But there's a lot of evidences. There's a gap between the application of your research output, recommendation, or even your conclusion. Because here in the hospital, we utilize the research. No? We question the status quo. Sir, you're questioning the standards of WHO? You're questioning the standards of CDC? Of course. Because their research is based on the Western countries. It's different in the Philippine context. Diba? Telemedicine. Telemedicine is very applicable on their country. But here in the Philippines, we don't have any internet access and even there's no device. So how come that the result is, sir, based on the journals, it's effective? Yes, because they have the means. Oh, please implement it in the Philippines. You don't have any devices. It will fail. Would you agree with me? Okay? Sir, mindfulness, yoga. Oh, we don't have any yoga. So, why not use other alternative? Diba? We can use exercises. Such as, so mga exercise natin sa Philippines, no? Or in mindfulness, we can use music. Sir, music, classical music, no? Oh, use our OPM music rather than the classical music of the Western countries. Would you agree with me? No? It's not only you are giving importance to the culture, but it is the resources of your country. Why not utilize it? Would you agree with me? The face shield made by the Filipino inventors. Diba? Ba't tayo nag-aangkat ng face shield na plastic? That we have a face shield made in a bamboo. Tama ba? Bamboo. Okay? Diba? Environmentally friendly, and we utilize our scientists. Diba? Ano pa? Sir, we have created the cure of dengue. Okay? Yes, the Philippines DOST created the dengue treatment. Thumbs up, thumbs up. Sir, why other countries did not get that cure? Because it is epidemic in the Philippines. The disease is epidemic in the Philippines. Thus, we create our own cure. Did you get my point? Okay? So it depends on our capacity. It depends on our area. Okay? Because the importance of PICOT, no? The importance of PICOT is to know the population. Maybe the interventions in the PICOT, the interventions, is not applicable in our specific situation. Okay? Katulad si Lucas. Ang mahal po ni Lucas. Mahal po ang Lucas. Nasa 350,000. I rather hire a nurse to perform CPR than buy Lucas. Did you get my point? But on the Western countries, they lack nurses. Thus, they utilize technology to even augment the lack of healthcare providers. Okay? Okay, clear? Next slide. Maybe it's last 3 or last 2. Mindfulness, again, you do deep breathing. You do balance, no? YOLO. Okay? You only live once. Work-life balance, sir. Okay? Stress reduction. Remove that bashing and even fake news, no? I want to challenge all of you, fellow leaders and fellow nurses. Please, no? Don't add junks, trashes in the social media. No? Give them truth, facts, and evidences. No? Let's be the nightingale in this present time. No? Dalhin mo yung lampara mo, pailawin mo yan. No? Hanggat mawala yung dilim ng pagiging ignorante at kamangmangan. Okay? And next is awareness. No? Stop. Awareness means you are aware of your body, not the external environment. Sir, sabi nyo awareness. No. Awareness of your own specific body, not the external factor. You'll get stress if you will focus or you're aware outside of your body. And last is body. No? So do your physical exercises. 30 minutes, 3 times a week. Okay? So this is the last slide. Sorry, last 2. Benefits of evidence-based practice. First, cost of care. Yan, cost of care, because we are not doing the interventions. And we may prevent litigations. Magastos po yung kasuhan, magastos. Okay? So, cost of care. No? There will be a decreased cost of care. Next is patient and staff satisfaction. Wow! You captured the near cardiac arrest of the patient and the patient survived. Thus, the nurse will, oh my God, I'm a hero in my own way. And the nurse and the patient are satisfied in our care because hindi siya na-cabbage. Okay? Hindi siya na-operahan because you and as nurses, na-refer mo agad siya, di ba? Ang sarap ng feeling, no? Ang sarap ng feeling. Next is resource sufficiency. Again, resource sufficiency. Bakit? You will gather your information and interventions based on the capacity of your country. Nagkakaintindihan ba? Huwag kayong kumuha ng mga intervention na kukuha pa tayo sa ibang bansa. Di ba? Sir, ba't lagi niyo sinasaba banana leaf, banana leaf? Eh, pwede kang kumuha dyan. Tama? Pwede kang kumuha dyan ng banana leaf sa tabi. Okay? And if it's effective, di ba? Walang gastos. Okay? Dun sa pressure ulcer. Okay? And they will be happy. And last is safety and quality. No? Through your prompt referral, no? You give quality care. And you maintain the safety, not of the patient, but you as a healthcare provider. Okay? And last will be the quote from my mother, our mother, Florence Nightingale. The most important practical lesson that can be given to you, to us nurses, is to teach them what to observe. Because in observation, it starts the EDP. No? Diba? Problem identification. And to that, I want to leave you with my own quote. Okay? Continue to be lovers. Nakakakilig, lovers. Okay? Lovers. Live by it. Grab every opportunity, value, and empower others to do research. Okay? So to that, thank you very much. And I'm now open for your question and answer.
And thank you so much, Dr. Morales, for that very informative and inspirational presentation. And what I can take throughout my journey as a future nurse also is evidence-based practice is indeed a long process that needs a further researches to improve our healthcare practice, especially here in the Philippines. So thank you, Doctor.
Whilst Dr. Morales, it also amazed us with the presentation that you showed us in the evidence base that it is really important and effective, especially on the nursing profession.
I hope our listeners were able to take every information, learnings, and knowledge by heart that will guide them throughout their journey.
Okay, everyone. We will now entertain your questions. You may send your question on the chat box and we will read it to you. Or you may utilize the raise hand button to be recognized. Okay, you may type na your answers, your questions rather, sorry. Yeah. Habang nandyan pa yung handsome and attractive doctor natin for the day, for the night. Okay.
Okay, we have the first question now, Doc. What can you advise for the future nurses who is afraid to do their duties or job in this time of pandemic?
Okay. So these are the mantra that I was always used in my nursing career. Deus manus caput cor. Okay? Deus manus caput cor. Deus is God. Or faith. I don't want to challenge or to question your God. That's faith. Next is Deus manus, is hands, your skills. Deus manus caput is your head, your knowledge. The tree of Deus manus caput is within your reach. You have faith, you have enough knowledge, and you have the skills. And last is core. Is your heart. Now, sir, takot po ako, baka po ako magka-COVID or baka akong magkasakit. I want to ask you again. Sir, I'm a fourth year student and you're asking again the question when I'm first year student? Yes, that's relevant. Why you took up nursing? Because nursing is altruism. Serving beyond yourself. Sir, nakakatakot pa din. Pero kung tayo ay titigil na mag-serve, sino pa ang gagawa? Okay? Sino pa ang gagawa? And you, as nurses, we as nurses, isama na ko sa sarili ko, we as nurses, we embrace not a profession, but a vocation. It's a calling from God. So kung ikaw ay tinatawag ng Diyos, tutugon ka ba? Sir, takot na po talaga ako. I want to ask you, what's your reason? Why did you take up nursing? Kasi ako, napakasimple. Gusto kong maglingkod. Naniniwala ako sa Diyos ko na hindi niya ako pababayaan. On that premise, even it's high risk, I will continue to serve. Because on the Bible, sabi nila, ang ginawa mo sa kalit-liitan sa atin ay ginawa mo sa Diyos. Okay? Diba? So, ibig sabihin, we're not only getting our job done, but we are serving God through our patients. Okay? Thank you. Sorry. Napahaba.
Thank you for that wonderful insight, Dr. Morales. And it touched me that we will use our faith, our head, and also our knowledge in combating this kind of pandemic. I like this pandemic or other issues in ourselves. So another question coming from 4B, Miss Audrey Belly says, Doc, how can you say if evidence-based practice is accurate or effective?
Okay, thank you very much. So based on my discussion, it will be based on your PICOT framework. No, you should check first. You should gather information based on the reputable journals. No? Wag dun sa mga predatory journals, because you will get trashes there, and there's no evidence there. But for us to have an accurate and effective intervention, check all of the elements and check if it's applicable to the Philippine setting. Okay? Kumuha kayo, no? Sir, the robotics is very good. Okay, robotics. Okay? Wala nga tayong iPad. May robots pa kaya? 'Di ba? Alam niyo yung ganon? Okay? So please be flexible then as nurse researcher. Because here in the Philippines, we're in the developing country, no? We are considered as a developing country. We have a lot of what do you call this? Not barrier, but we have a lot of challenges. And please take note of this. And through, sir, pwede naman you can be inspired to utilize interventions that is comparable to the researches. Okay? You can use other alternative. Okay? So yeah. And for the effectiveness, it will depend on the implementation of your EBP. Nagkakaintindihan ba? Gagawa ka rin ng sarili mong research. I-check mo din kung effective ba yung sinasabi nila, and you will contribute to the evidences on that practice. Nagets nyo? Parang cycle yan. You will add, you will question the evidence-based practice. And take note, I want to give you this. In the hospital setting, we're not using textbooks as references. Okay. We are using journals as our references. Because textbook, it entails, napapublish yan ng, kung this year siya napublish, ginawa yan ng 2017 or 2019. So, obsolete na yan. Not like in journals, if you publish it, no? So, that's very current. Okay? So, kaya, magtataka kayo, bakit hindi nagbabasa ng libro ang mga nurses dito? No, we're reading journals. Okay? Not books. Thank you.
Okay, thank you for that, Sir Dr. Morales. So again, for the summary, we should gather more evidence for us to have for this evidence base, and then check if it's applicable to the Philippines. Ganyan. So we have another question here. Given the limited hospital exposure we have due to pandemic, what could you advise us to have a research that will be considered as an evidence-based practice that will still have the elements of this evidence-based practice?
Okay, thank you very much. I want to ask the student, are we a consumer or producer of research? Are we a consumer or producer of research?
Both, sir.
Okay, very good. Miss Anna. Both. Thus, because we are a producer of research and we are the consumer of research, we can create an EVP. Not in the clinical setting, but in your own setting. What? Yes. You can check, you can evaluate the online learning of the school. Okay? You can evaluate the mental health training or the mental health wellness program of the school. That's evidence-based practice. Diba? And you have a lot of evidences that proves that hindi ko masasabi kasi hindi ko alam yung mga interventions. But there's a lot of evidences. Okay? Because other countries have done perfectly, not perfectly, but almost perfect online classes. Nagets nyo? So, ibig sabihin, may evidence pa din na pwede nyong magawa. Sir, hindi po kami makakapag-contribute sa body of knowledge. No. You will contribute to the body of knowledge in the nursing education. Hindi kayo ang magiging recipient. Kayo ang producer. Pero ang recipient is the future nurses. Nursing students. Okay? Clear? Ano pa? Sige. Sir, gusto ko may sakit po. May sakit. Sige, lagyan natin ng sakit. Okay. Yung bang mga teleconsultation, okay, is applicable. Kasi though hindi kayo hindi tayo nag-face to face, hindi kayo napunta sa ospital, but you have the power, no? You have the power to interact. Tama? Through social media. Meron ng, may mga evidence na yun. Diba? Sa ibang bansa kasi, teleconsult lang sila. Diba? So, yun ang pwede nating ipakita, that there's evidences and we should implement that best evidences. Pero take note, meron talagang matitigas ng ulo or talagang ayaw nila talagang maniwala sa teleconsultation. Kaya yung isang sphere na patient's preference or value, doon tayo mahihirapan. Kung a-accept ba talaga ng mga Filipino itong teleconsultation. Okay? Clear? Clear po ba? Again, we are the consumers and the producers of research. Thank you for that question.
Thank you again, Dr. Morales. Again, from the 4D. Daming tanong mga 4D ah. From Emily Tia. Doc, what can you advise for students who are losing determination in their research project?
Gagraduate kayo. Okay, kidding. Okay. So first is you should be in love. Diba? Ma-in love ka doon sa research. So, ma-in love ka, puyat po kami, sakit na ng ulo ko, namuti na yung buko. Okay. Love. Live by it. Every day diba? Saan ka kakain? Research mo yun Diba? Uy, manood ka na Netflix. Yung pagsa-search mo ng Squid Game na iyan, ayan ay research. Okay? Tawa ka ng tawa dyan. Nood ka na nanood ng Squid Game. That's research. You live by it. Tawa kayo ng tawa dyan. Okay. Oh, opportunities. Diba? Grab every opportunity. You have an opportunity to change the nursing profession. No? Sir, ang nakikita ko naman, transcript naman po yan No, stop it. It's not only in the degree, to get the degree, but you're doing this for your patient or for the nursing students. Okay? Sir, bakit po ganyan kayo magsalita? Kasi hirap na rin ako maggawa ng research. Pero, yung aking research kasi is lived experiences of cancer patients. The pedya. Anong point ko dito? Hindi yun para makuha ang master's degree. Pero, para maintindihan lalo ng mga doctor at nurses yung buhay ng isang cancer patient na pediatric patient. Hirap na hirap ako noon. Pupunta ako po sa bahay nila para po mag-interview. Sir, bakit? Ano yung nag-drive sa inyo? Because I want to have, for them to have voice. No? So kung ganun kalalim ang hugot mo sa research mo, ay kahit umiyak ka dyan ng umiyak, matatapos mo siya. V, value. No? Appreciate small wins. Yes! Nakapasa ako, yung chapter 1. Boom! Chapter 2, daming revision. Kaya yan. Anong point ko? Celebrate your small wins. Bakit? Kami ba ni Doc Virgo? Kami naging doktor agad na isang click lang. Naku, Diyos ko po. Sinasabi ko sa iyo, umiyak kami niyan. Okay? Umiiyak ako noon sa 5 panel. Di ba? Pulang-pula. Doktor na kami, pulang-pula, as in pula. Sabi ko, may tinama po ba ako, Doc? Sabi niya, marami naman. Okay, natawa lang ako. Pero sabi ko, value everything what you do. And last is empower others. Kung kami ni Doc Virgo ay talagang niyakap na namin ang research, minahal na namin siya, pinakasalan ko na nga yata itong research, we empower others to do it. No? Wala pong madali sa research. Ako may prangka, no? Prangka ako sa mga estudyante ko din. Mahirap ang research. Pero kung ito i-dedicate mo, hindi sa sarili mo, pero sa iba, mas magaan. Katulad nyo, bakit ka ba nagna-nursing? Para po sa magulang ko. O, di gawin mo. Bakit ka nagre-research? Para po matapos ang degree of nursing. Superficial. Superficial. Kasi pag hindi mo natapos, titigil ka na maging nurse? No. Malalim. No? Ulitin ko. Deus caput manus cor. Go back to your core. 4th year ka na. 3rd year ka na. Ngayon ka pa susuko. Maraming umaasa sa atin. Maraming umaasa sa atin. Okay?
Thank you, Dr. Morales, for that. Of course, we have to love and live by it, sabi nga ni Doc. And go back to your core, di ba, Doc? Yan. And then now, another question from Mejia Jimaima from BSN4D din po. Doc, the development of research evidence enough to change long time or traditional practice?
I love the question. I so love the question. Change equates resistance. It takes time. Diba? Ikaw, 30 years na ganito yung routine mo, tapos sasabihin mo doon sa matandang nurse or doon sa senior nurse, ma'am, mali po yung vital signs nyo, pagba-vital signs. Mag-ingat ka, okay? So, there's a process of change management, okay? So, mag-ingat tayo doon sa change management. So, we should be careful in injecting interventions or innovative interventions because there's a lot of resistance to the practice. Sir, paano po ma-address yung resistance? Educate them. Ma'am, ito po yung evidence eh. Ito po yung gagawin natin. And the change should be gradual. Nagkakaintindihan po ba? Change is gradual. No? Step 1 to step 10. So gawin mo na lang po natin yung step 1. This month, step 2 next month. Okay? Bakit? Kayo nga. Di ba? Pag nabago ang routine nyo, galit na galit ka na sa magulang mo. Ano? Mami, nasaan yung aking medyas? Dito ko lang 'to nilalagay. 'Di ba? Nagagalit kayo. It's the same as the change. Would you agree with me, no? In the mababaw na pag-iisip, no? Ganun siya. Okay? Clear? Again, gradual change. Involve them. Okay? Involve them.
Thank you, sir, for that insight. Ika nga nila, change is inevitable. Okay, everyone. So, another question from Ngausi Danica. Doc, how do you address people prejudiced against scientific facts?
Show them proof. Number 1, show them proof. Ayaw niya na ako nakausap. Minute niyo ako. Okay. Ayoko na po magsalita, Doc Virgo.
Sorry
Okay.
na po.
Okay. Wait lang. Nasaan na ako? Okay. Present facts. Okay? Next, be credible. Okay? Be credible. Sir, paano maging credible? Ikaw mismo, ikaw yung nagpo-push ng change or innovative change, should be credible enough. No? Pananamit mo pa lang, pagsasalita mo pa lang. So, you should be professional enough. And through your interventions, through your actions, it speaks your credibility. Sir, ang tigas pa rin eh. So be it. Basta't sinabi natin ang katotohanan, ang ebidensya, kung siya ay pumalpak, doon niya makikita na nagkamali sila. Okay? Alam ko, si Mac, no? Friend ko yata na si Mac. Mapapansin mo yung aking post, hindi ako nambabash or hindi ako nagko-comment sa mga negatives because I believe ko okay mag-comment doon, mas mababa yung level ko sa kanila. So I rather post facts, truth, or even my own poems to inspire people. But to bash them, wala akong time doon. No? So I present facts and truth. And you cannot please everybody. But you, as nurses, makinig kayo our role is educate them. Okay? Remove the ignorance, remove the gloominess of dito, ang kamangmangan, no, tanggalin natin sa kanila. Sir, ayaw pa rin nila, binabash po kami. Okay. So be it. Ang atin, ginawa natin yung makakaya natin. Okay? Ang dami ko nakita mga post, no, mga kabataan pa naman, no. Wala daw, hindi daw totoo yung COVID. Sabi ko, okay. Prepare sila ng 4 million or 10 million. Okay, sige. And maybe if his or her family had been a patient, maybe dun sila maniniwala. Okay? Thank you.
Thank you again, Doc. So again, give them facts or evidence and then be credible. Ayan. For another question from, wait, nawala po tayo. Another question from 4B, 5. Good evening, Doc. What can you say about the situation of nurses here in the Philippines, wherein they are underpaid, undercompensated, and underappreciated? Do you think it's true and why?
Napainom ako doon. Hindi ko na alam kung ano ba, bakit yan na mga tanong. Evidence-based practice. Okay, so, okay, this is my opinion. Okay, again, disclaimer, this is my own opinion. No, hindi to opinion ng Asian Hospital or whatever organization I'm affiliated with. My opinion is, I totally agree. Matagal na namin pong pinaglalaban ito for the past 10 years of my nursing career. No, I started my salary 8,000 and a volunteer nurse. And I totally agree with the exploitation or even the injustice. But as professional nurses, I can do in my own capacity to support them. No? Ako yung tao na susuporta ako, no, through other means, posting of my poems, narrating, no, but I will not go beyond that. But I'm with our nurses. Sir, ano pong inyong take dito? We're doing our job, no, to fight for you, to fight for us. So please, that's also a challenge for you because you're future nurses. And this is our rights and our law. Okay? Please pray that our law will be signed by our president. Doon ninyo makikita that we are advanced nursing practitioner. What? Yes. Pwede na tayo mag-prescribe, pwede na tayo mag-admit, pwede na tayo mag-discharge. Would you love it? Heart naman? Walang may gusto ata nun. Okay? Because, alam nyo, nakakalungkot, we are best in the world, pero nahuli na po tayo. ASEAN countries have their own advanced nursing practice. But here in the Philippines, behind na po tayo. But we are the best in the world. So doon ako nalulungkot but para sabi ko, ba't ganun? Tapos wala tayong mga scientists, ba't ganun? Ilan lang scientists nating nurses, pero ang gagaling ng mga nurses natin. So, in these trying times, no, sana hindi lang 'yun ang nakikita nyo bilang mga nursing students, no? Yung darkness of nursing. But ang nakikita naman namin, no, mga young leaders is we have hope. No? May pag-asa pa rin tayo. At pinaglalaban namin ito hindi para sa amin, sa inyo. no? Pag kayo naging registered nurses na. Okay? So, kayo ay sana suportahan niyo po kami. Okay? Sa ating laban. Okay? Ulitin ko, ang laban na ito ay hindi ako yung nag-rally. Okay? Okay, on the back of the people. Okay? So, yan. But, totoo yun. Totoo yun. Ang dami ko ng mga nakakausap ng mga nurses na they rather stop on their duty. Pero tinatanong ko, bakit hindi ka pa rin tumigil? Mix yung pasyente kasi. Mix yung pasyente. Dialysis patient, mix yung dialysis patient. Sino magka-cannulate? Alam, mag-cannulate sila ng kanila, di ba? Walang tao sa COVID area. Di ba? Kahit mag-sacrifice ako na hindi ako umuwi sa family ko na may anak din ako, that's some of the narrations of our nurses. So, sana supportahan nyo kami, no? Nursing students, supportahan nyo yung aming laban. Ang ating laban, no? Isasama ko na kayo, dadamay ko na kayo, ating laban. Kasi, you're RNs na. Okay? Ang mag-heart, top-notcher. Walang nag-heart. Ayaw nyo mag-top. Sir, ano lang po, isa-isa lang po. Okay lang yun. Okay? Top 1, 100. Okay? Okay? Next.
Okay, thank you, sir, for that inspirational insight. So, additional question po, sir, coming from Sir Philip Banagen. Doc, in this time of pandemic, are there specific studies that you would want to conduct or suggest to our student researchers to conduct? May many suggestion kayo, sir? Parang si Sir Banagen naghahanap ng i-research niya, sir. May suggestion po ba kayo kay Sir Banagen, sir?
Okay, number one, because in these times of pandemic, it's the pandemic flavor. No? So, ako kasi is qualitative researcher. More on phenomenology ako. So, number one is live experiences of COVID-19 survivors. Live experiences of COVID-19 nursing student survivor. Magkaiba yun. No? The patient, yung isa naman, student. No? Okay, ang ganda nun. Kasi it will help the university how to manage them. Okay? Kasi 14 days yon na naka-quarantine. Ay paano namin kayo? Ida-drop or paano ba yon, di ba? So tutulungan nyo kami para maintindihan ano gagawin namin sa mga estudyante. Next is pwede nating gawin din experimental research. Di ba? How the students cope, no? With these trying times, no? Yan. Then fourth is gamification. Yan, gusto ko yung word na gamification. Sir, ano yung gamification? Paggamit ng mga games, no? For teaching, no? So hindi lang parang hindi lang yung mga kahot-kahot na ganyan. Hindi. Yung gamification talaga as in parang naglalaro lang kayo, yung feeling nyo ng mga nursing student, naglalaro lang kayo. No? Parang wala siyang no-brainer siya, but you are being challenged your manos, your skills. Yun the four. Live experience of patient, live experience of nursing student, experimental research regarding the coping mechanism, and last is gamification. Okay? Yung game, yung paggamit ng games. Yun.
Thank you po, Doc. So, additional question from Ms. Agad DJ Ayumedi. Sir, as a student nurse, are we permitted to carry out evidence-based practice in nursing, or do we need the license? Do we need to be licensed to do that?
Okay, thank you very much. So, it depends on the EVP. It depends on the evidence-based practice because some of the evidence-based practices are not registered nurses specific. No? Diba? Yung sinabi ko sa inyo na in the community level, in your community approach, the use of banana leaf, no? Kaya nyo yun kasi tayo na yung pinakamataas na healthcare provider dun eh. So, sino gagawa? Diba? But yung specific, yung mga medication, yung mga technology-driven, no? more on ano pa yun, registered nurses. Okay? And it entails collaboration. Okay? With nursing informaticists, the medical informatics, engineering, biomedical engineering. So sa hospital kasi, multidisciplinary lagi yung approach, no? Para sustainable yung outcome. Sa community-based, probably you can do it, no? Kasi 'di ba, pag mga nursing student, parang doktor na kayo, 'di ba? Parang doktor na kayo sa baryo, 'di ba? Umubo lang, naka-COVID po ba 'to, 'di ba? Pinupuntahan agad kayo ng ng ating mga community people. But again, make sure na lahat ng sinasabi niyo ay may evidence. Okay? Wag yung okay po, naku, may COVID po kayo. Sige, magpa-x-ray na po kayo. Okay, wag, stop it. Okay. You carry, okay, makinig kayo you carry the profession. Hindi si Mac lang yon yung sinasabihan. Ang dala ni Mac ay yung nursing. Dala mo kami, Mac, pag nagtanong yung pasyente. Okay? Sir, parang bigat. Oo, dala nyo kami kasi mabigat. No, ang point ko dito, lahat ng sasabihin mo is truth and facts. Nagkakaintindihan ba? Kaya dun sa mga post, mag-ingat din kayo. Because you're identified, you're a graduate of this university, you're a graduate of nursing, you're a doctor of nursing. So, talagang magre-reflect yun sa lahat. Okay? So, please be careful. Yun.
Okay, thank you again, Doc. So, another question po dito sa comment section. Doc, how do you stay update on current events on medical and healthcare industries? Ba dito, sir, nagtatanong sila on the specific websites or any reliable source of these evidence-based practices na stay up-to-dated po.
Okay. So marami naman yan, no? Matutulungan kayo ni Doc Virgo, pero yung pinaka ginagamit natin sa healthcare is the Scopus Index. Sa Scopus Index kasi, if you search it, lalabas lahat yung mga reputable journals, no? So, doon kayo pwedeng mamili, no? And I want to boast our Philippine Journal of Nursing. Okay? The Philippine Journal of Nursing is one of the peer-reviewed journal and award-winning journal, okay, in nursing. And there's a lot of evidences there. Okay? So, and tangkilikin nyo ang sariling atin. Nandun kasi yung mga researches ng SLSU, di ba? Ng Baguio University and even your university, no? Doon mo makikita, magiging proud ka, oh my God, ito yung mga senior nurse ko to noon or senior students ko noon, di ba? So, to that, and kasi siya, kaya gusto kong i-highlight ang Philippine Journal of Nursing because it's Filipino-based or Philippine-based, okay? So, para hindi kayo derailed. But again, Scopus Index, no? So Doc Vergs will give you the details, no? Maraming yan, mga references.
Okay, thank you again, Doc. I think we are here for the last questions. So coming from Sir Kenji Tolero, Doc, as height of COVID-19 increases, what are the efficient practice and intervention that we must possess as a future nurses in the workplace in relation to the new heightened protocols the government has mandated?
What are the efficient practice intervention we possess? Okay, so the basics, no? We'll never go wrong to the basic of hand hygiene, no? The cough etiquette, the social distancing, even the face shield. Sir, face shield, yes. Kaya tayo nag-face shield is for us to prevent touching our face, the orifices. Okay? So yan kasi mga portal of entry. Sir, wala namang rocket science dun Hand hygiene, face shield, donning and doffing. Yes. That's the best protection and prevention that I can give to you. But there's more. Sa Japan, ibang ginagawa nila, no? Okay? Lang to para makita niyo naman yung ibang perspective ng mundo. Okay? Sa Japan, ang nagva-vital signs ay mga robots or nakaano na siya, may mga attachments, no? Parang ano, para siyang mga cardiac monitor. So alam niyo naman yan, no? Mga cardiac monitor. Then naka-connect siya sa artificial intelligence. What? Artificial intelligence? Yes. So makikita ni nurses, oh, ito yung trend niya, tapos nag-interpret na. Okay, di ba? No-brainer na yung nurses. No, ang gagawin ng mga nurses naman, intervene. Okay? So yun na yung future ng ano, ng healthcare. Will not be a slave of the technology, but no, yun ang mahirap, no? Ayaw natin maging slave ng technology, but we should what? Ikaw dapat yung nasa top. Kailangan ikaw yung nagmamandate dun sa technology. Kasi kung hindi, kakalungkot, baka mapaltan tayo. Pero hindi mangyayari yun. Kasi wala silang core. Nagkakaintindihan ba? Wala silang core. Okay? So yan, yun yung aking ano. Go to the basic and you'll never go wrong. Sir, bakit sila nagkasakit? Hindi sila nagugas ng kamay. Yun lang. Period. Okay? Bakit sila nahawa? Kumakain, magkakasama. Ay, di ba social distancing? The social distancing. Okay? So, yeah. Thank you.
Ayan, thank you so much for that wonderful insights again, sir. I like to show to you the difference between the Philippines and other countries. So, as a future nurses, as a future doctors or technologists, papayag ba tayo guys na papahuli tayo with the other countries? Hindi, di ba? Gagawin natin lahat ng makakaya natin as a future nurse to stay updated, do some research and also.
So it looks like that we have covered all of your questions. Why don't we call on students from the University of the Cordilleras naman to narrate us your insights?
Wait.
Yes po, Doc.
May PM po. Wait lang po ha. Doc, please, okay. I would like to ask po, what were your ways and strategies po para makapass ng board exam? You're really that great po after you graduate. Okay, so tips na, no? So future nurses, no? Ito lang, last question na. Sabi nila, gawin ko daw yung libro ng MS, si Sudart, no? Gawin kong unan si Koshir. At gawin kong tinapay si Benson. Kidding, no? Tinatatawa ko lang sa kayo. But it entails rigorous planning and rigorous rigorous preparation. Ako, hindi ko, sir, top-notcher kayo, hindi. Yun ang pinakamasakit, hindi ako nag-top. Kaya ako naiyamot, nag-masters agad ako. So, nag-masters ako, 22 years old, nakuha ko yung aking degree. And 30 years old, nakuha ko yung PhD or doctorate. So, sir, I want you to not only achieve, sir, that's our achievement RN. Oo, naintindihan ko yun. But go beyond your dreams. Noong ako yung nagre-review, Minudal M. Morales, RN man, PhD. Ang yabang ko noon, 2010 yon. PhD. Sabi ko, naku, baka ako mapagalitan ng Board of Nursing at naglalagay agad ako ng RN, di pa ako napasa. Law of attraction. But the secret of law of attraction is you do something with it. Hindi yung law of attraction, ako'y papasa. Hahampasin kita ng libro. Hanggat hindi ka nagbabasa, hindi ka papasa. Hanggat hindi ka nagbabasa, hindi ka papasa. Bakit? Law of attraction. Ay, paano ma-attract ang tamang sagot kung hindi mo alam at wala kang alam, di ba? So, again, sir, Deus po. Oo nga, may faith ka. Wala akong question sa faith. Pero meron ka bang kapot? Nagkakaintindihan ba? Meron ka bang ilalagay dito? Sir, I'm passionate of being a nurse. Sir, mahal na mahal ko po ang nursing. Oo nga. Pero wala naman ito. So paano ka papasa? Ulitin ko, ang nagbabasa ay pumapasa. Anong ibig kong sabihin? Binaktuba ko po yung si Sudart. Baliktaran. Walang lumabas. Doon ako naiyamot. Cancer daw ang lalabas. Ang lumabas, pneumonia. Sabi ko, lahat ng cancer binasa ko. Tapos pneumonia ang lumabas. Pero, doon ko na-realize na kung hindi ako nagbasa ng back-to-back, cover to cover, pati mga table of contents, no, sa sobrang addict sa pagbabasa, hindi ako masasanay magbasa ng mahaba na cases ng community. Ang community po sobrang haba, as in isang page, ano lang yon, ang tawag doon? Case. Tama, Doc Verbs? So, kung ako'y nakatulugan ko si Sudart, ay baka makatulugan ko ang board exam. Nagets nyo? So, parang nilalagyan ng yung tinatawag na mental stamina, no? Ang aking na-train. Okay? So, yun. Again, faith. Yes, wala akong problema sa faith, wala akong problema sa passion, wala akong problema sa skills. Lagyan nyo ng kaput. Okay? So, at hindi ito isang click lang, no? Alam nyo, napakaswerte nyo. Nung panahon ko, 3 paper bag ang dala ko. Okay? Iliteri, 2 libro, 2 libro ng MS, at 2 libro ni Kushier. Okay? Dala-dala ko po yan sa school. Okay? Sabi nga nila, ano ka, librarian? Sabi ko, wala akong pakialam sa iyo. Akong pakialam ko, ako yung nurse. Nakakaintindihan ba? At ito ang lagi nyo ilagay sa inyong mga isip. Walang makakapag-judge sa inyo. At walang pwedeng pumigil sa inyong dream kundi ikaw. Nakakaintindihan ba? Kahit yan ay magulang mo, kahit yan ay kung sino man, kahit asawa mo yan, gusto ko maging RN, gusto ko maging RN. Nasa iyo yun. Kung ayaw mo maging RN, nasa sa'yo din yun. That's it. The simple as it. Kasi kung mahal mo, ibibigay mo lahat. Kung hindi mo talaga mahal, ay kahit anong gawin mo dyan sa libro, gawin mo yung tsaa, hindi mangyayari. Okay? Nagkakaintindihan ba? At ulitin ko, hindi ako plastic. Mahirap talaga. Okay? Mahirap ang pagdadaanan nyo. Pero, it's worth it. Because, ito lang ilagay nyo sa isipan nyo. Tingnan nyo ang kamay nyo, guys. Tingnan nyo ang kamay nyo. Gumanyan kayo. Madumi. Sabi na, mag-hand hygiene nga kayo. Diba? Mag-hand hygiene. Ang dumi ha? Mag-hand hygiene. Okay? Every time na nagbabasa kayo, makinig kayo ha, every time na nagbabasa kayo para sa review nyo, buhay ang kapalit. Nagkakaintindihan ba? Okay? Yun ang inyong motivation. Pabigatin ko pa. Mabigat. Buhay ng magulang mo ang nakataya. Sir, bakit naman magulang ko? Magulang ko din ang nakataya. Okay, lahat na. Okay, magulang ko, kapatid ko ang nakataya. Because, probably, pwede silang maging patient. Nagkakaintindihan ba? Okay? Nagkakaintindihan po ba? Bibitawan nyo ba yan sa inyong mga kamay? Sa tingin ko hindi. Again, I want to challenge all of you. Hanggang kailan mo siya hawakan? Okay? At pag naging RN kayo, simula pa lang yan ng inyong laban. Pero, I will make sure na kami na nandito ay nasa likod nyo lagi. Marami kayong pagdadaan ng pagkakamali. Hindi lang sa pag-ibig, pero maraming pagkakamali sa practice. Pero kami ay nandito para kayo gabayan. Okay? Hanggat kami naririto, diba? Hindi kami sumusuko sa Filipino nurses, no? Hindi kami nag-abroad ni Doc Virgo, diba? Because we believe in you. Okay? We believe in you. Kaya kung kami naniniwala sa inyo, Bigyan nyo naman chance ang inyong sarili. Paniwalaan nyo naman. Okay? So to that, thank you and heart, heart.
Heart, Doc. Thank you so much, Doc. It really inspired us po. Now, may we call on students from the University of the Cordilleras to narrate us your insights. So let's start first for Miss Yala Opiniano.
Ayan. Good evening, everyone, and to you, Dr. Morales. I would like to say that that was a very beautiful and inspiring talk. Very informative, insightful, and educational po. So, what struck me the most on a personal level and as a student nurse was when you said that problem identification should be specific in order to have a specific solution to the problem. I personally is the kind of person who wouldn't find the fastest solution to a problem. I wouldn't look into it specifically or dive into it because I tend to get it done with as soon as I can. So when you said that, I realized that maybe it is time to dig into problems in order to properly assess them, especially when facing patients in ways of like what you said po, doing research, since this is as well important for our nursing practice in order to support our nursing interventions. Also, like what you said po, na nursing is a calling from God, and in return to this, we will serve God through our patients. I find this really beautiful po. Additionally, I got inspired to be the best version of myself then as an aspiring nurse because when you said that the best practice of a single nurse could uplift the hospital, ayun po.
Okay, thank you so much for that, Miss Kiala Opiniano. What an in-depth insight regarding Mr. Dr. Morales' presentation. So for the next insight, who would you call here? Okay, I see Miss Shaira Anitabios. Give us your insights.
So I truly agree, sir, about the importance literature review, and through evidence-based practice, we can enhance our nursing proficiency. Following the steps just like the ADPA in the nursing process, we can solve problems that is arising. As you said a while ago, best practices of nurses uplift the hospital with proper knowledge and skills. We can give our patient a high quality care. Every year, there are a lot of evidence-based practices that is being done. Just like us, when we're having our duties, we are doing a journal study with this. We are also being updated on what is happening in the healthcare practice, not only in the Philippines, but also throughout the world.
Ayan, thank you so much, Miss Shaira. What a heartfelt speech. So let's go now for sino kaya, Miss De Los Reyes?
Ma'am Monique, parang ganda sa screening mo, Ma'am Monique.
Okay, let's go with Ma'am Monique Piliden.
Okay, Dr. Mignadel Morales, sir, once again, I want to say that it is an honor to have you for today's speaker. You have inspired me and I have learned a lot from you. So I like it, sir, when you said that research can defy or prove a theory, a hypothesis, or even a speculation. And from that, I realized that as research can save the world, change the world, and even save lives. So fellow listeners, I want to say that please love research. Be in love with it. Marry it if you have to. Because after all of our actions as nurses are evidence-based nursing research. Thank you so much, sir.
All right. Thank you, Miss Monique Toledan, for that wonderful and motivational quote regarding that. So for the next one, or the last or not the least, last but not the least, who can we call here?
Yung pinakamagandang boses na kumanta kanina kaya.
Sino ba yun? Ayun, Miss Sarah Estayo. Can you give us your insights regarding Sir or Dr. Morales' presentation?
Okay, so yes, thank you for that. Hello, good evening. Good evening, Dr. Morales. I am really happy. We are very happy that you are here for us to impart your knowledge and answer the questions that we have, really confused regarding the evidence-based practice and research. So what my insight is that I agree on what Dr. Dr. Morales said, since the first slide or since the first word that he said earlier, it comes all about that evidence-based research should be backed up with evidence information. So we should be aware and use Deus manus caput cor. So that will be a part of me in my process so that I can use this as my lucky charm, my reminder, and also be my answer in my confusing question about being a nurse. And this will also be my stepping stone in my nursing profession journey so that I can be the nightingale in this present time. Thank you.
All right, all right. I hope ako rin magiging nightingale in my present time, you know? Okay, with that, from the bottom of my heart, ayan yung heart ko, guys. Ayan. Again, thank you, Dr. Morales, for the time, for the effort, and the lifelong learning that you've shared to us.
We will now proceed to the giving of a certificate to our guest speaker, which will be presented by Dr. Virgo Clemente Lopez and Ma'am Judith Lyle.
Good evening. Before anything else, good evening, Dr. Mignodel. Can I make a quick comment from the perspective of the ladies? It is as if we are in the competition of Miss Nightingale 2021 with their responses, right? So can we give them a big round of applause, the ladies, of course, for their insights, right? And good evening, Miss Judith Layaw, our program chair. Maraming salamat po sa pag-attend. So on behalf of the University of the Cordilleras College of Nursing, our dean, our program chairs, and the entire student body, may we present the certificate or e-certificate of appreciation to our speaker for tonight. May we flash it, please? May I read the content? University of the Cordilleras College of Nursing awards this certificate of appreciation to Dr. Mignodel M. Morales as a resource speaker in the webinar series entitled Evidence-Based Practice in the Nursing Profession with the theme Nurses Convergence on Lifelong Learning and Quality Improvement, a webinar on evidence-based practice held on September 24, 2021 via Zoom application or platform. Signed by the Academic Dean, Dr. Judith Odani Magwilang, and yours truly, the instructor of this class. Okay, so ladies and gentlemen, let's give a virtual clap to Dr. Mignodel. And on behalf of Ma'am Judith Layaw, maraming salamat po. And may we invite Dr. Mignodel and Ma'am Layaw for the photo op for this part.
Thank you very much. Thank you for the invitation.
Technical committee, can you give us a cue, please? Thank you.
So, okay, I'll be the cue for the photo op. Okay, so counting now, 3, 2, 1. And once more, 3, 2, 1. Thank you, everyone.
Thank you, Dr. Lopez and Ma'am Layaw.
Ma'am Layaw. Okay. Okay, but wait, there's more. We also send a simple appreciation for as a token, as a simple appreciation to express our sobrang thank you. So, pero sir, huwag niyang tanungin kung ano yan. Surprise na yun, sir. Basta darating na lang sa'yo at your doorstep with the top of JNT Express. Diba? Meron tayong sponsorship dito sa Zoom natin. Okay, please.
Okay, for the closing remarks, again, may we call on again our very attractive and hardworking Professor Dr. Virgo Clemente Lopez.
Please call me Sir V. Maraming salamat. And good evening, everyone, to our program chair, the ever supportive program chair, Ms. Judith Layaw, for representing our dean and our other program chairs, and also our other faculty who are with us tonight. And of course, Dr. Mignodel Morales, my fellow researcher at heart. Thank you for saying yes to the invitation, though we know that you're busy in your job as a full-time nurse, at the same time, quality improvement advocate at that. Wala po bang root cause analysis ngayong gabi or ngayong linggo? All right. Kidding aside. And kidding aside, there was this bulk of information and inspiration that you have shared to our students and to the entire student body and who are present here are student, by the way, the third year and the fourth year students. Now, I would like to summarize the lessons learned from Dr. Mignodel. I don't want to compete already with the ladies who have already and gratefully expressed their learning. You mentioned about the core, the faith, and so on and so forth. And I would like to summarize that in the education perspective, the head, the heart, and the hand. All right. So the head, when it comes to all the information needed, the competency for you to be able to carry out your tasks as a nurse, as a servant, for example, as a public servant at that. And to the personal level up to the professional level, from the individual to the institutional level, you were able to really talk about things that are vital and beyond the technicalities of evidence-based practice is the idea of really utilizing this. And our students here have been really working on the research, except for our third year students, and they know exactly the importance of dissemination of the results. And I like the way you have emphasized that the outcomes and the results are useless, not unless they are really used. It could be practiced. Now, via chat box, I would like to prove that our fourth year nursing students know the different ways or practical ways to disseminate information or result of research. There are actually three. The first one, please use the chat box. I hope for D, for B, or any from the classes. Oh, di ba? Sumagot na. The first one is publication. What else apart from publication? Another P, please. Of course, in Research Congress, the poster presentation, and of course, the oral presentation. And finally, tonight, Dr. Mignodel has emphasized the last P, which is, anyone? Please type in the chat box. Yeah, you may present. Yeah, you may publish. Yes, you might have the poster that would really capture, for example, the attention of everyone. But if you don't do it yourself, then it's useless. What's the last P? Can you please unmute and say the word? Sabay-sabay. It's evidence-based. Everyone?
Practice.
Oh, diba?
Practices.
Oo na nga. Oh, diba? There you go, mga kapamilya, fellow nurses. So there you go. And be a nightingale of our times. So regardless if you're students now, you would be nurses, you would be leaders someday, you would be managers, or dream big. You might be the next chairperson of the board of nursing who would be making significant changes, not overnight, but along the process for us to finally make or somehow give the necessary benefits or for us to continuously improve the nursing profession. So more likely, let me end tonight's event with the idea that love is the word for the evening. Love research, love yourself, love your dream, love this country, love this profession, and love everything that makes this life wonderful. And so, research and innovate continuously because they satisfy all of us, and finally, they save lives. Maraming salamat po at mabuhay po, Dr. Morales, our administration of the College of Nursing, to our students here, and congratulations to Section 4B of NCM 119. Magandang gabi po.
Thank you po for that, Sir Virgo. So thank you again, everyone, and we appreciate your participation in this webinar.
For our dear listeners, you will also receive your own certificate of participation. A link is sent on the chat box. You can now, it's already sent na po. That will direct you to our Google form. Please answer it accordingly.
Okay, but wait, huwag na kayo aalis, guys. But before we end this session, can we ask for you to turn on your cameras for the photo op and the technical team will give us the cue.
Also, kindly take an individual screenshot of this event that will serve as your evidence that you attended this webinar. So take it away, technical team.
Diba, Dr. Morales, may application agad? Evidence daw.
Okay, additional po. Though I'm not a faculty of University of Cordillera, but I will be your mentor if you want to. Okay, you can message me. But not the board exam. No. Be your coach or mentor no? Mag-PM kayo sa akin. Sabihin niyo, sir, I'm the student of ano. Mahirap po kasi sobrang dami na ng Facebook friends ko, so probably baka sa Messenger. Okay, so to that, again, thank you very much, University of Cordillera. This is an opportunity because my purpose in life is to inspire young nurses. So maraming salamat at na pinufulfill ninyo yung aking purpose. Maraming salamat po. Thank you.
Again, okay, so thank you everyone for attending. So for the final documentation or photo op, so I'll be counting in 3, 2, 1 for the first slide, second slide, 3, 2, 1. Thank you, and the last one, 3, 2, 1. That's all for the. Okay, thank you.
Thank you for the technical team. Sorry. Again, thank you everyone and magandang gabi.
Good evening.
Naimbag na gabi.
Thank you. Maraming salamat.
Thank you, Doc. Thank you, Ma'am Judith. Thank you, sir.
Thank you, Judy.
Thank you
Ma'am
po.
Judy.
Thank you po.
Dr.
Thank you.
Thank you.
Dr. Morales, I owe you one.
Pupunta ako dyan sa Baguio.
Opo. Then I owe you 2 and 3. All right. Then let me repay in the same way. Thank you, Dr. Morales. We'll see you soon.
Yeah, see you soon.
All right. For D, please stay. The rest of the students, you may now leave. Maraming salamat po. To the technical committee, you may now begin removing participants if they don't want to remove. I mean, to leave for us to have our post-event discussion. Thank you.